This is Dr. Timothy Sullivan. I'm a physician with experience in tropical medicine, in epidemiology, and immunology, making a presentation about the transmission of the Ebola virus by respiratory secretions. It's been known scientifically for greater than 20 years that Ebola can be transmitted from animal to animal through the respiratory route. Now the question is, to what extent is that a problem from person to person? There are increasing data that indicates that this can occur, does occur, and we're not protecting healthcare personnel and others from these secretions.
One Utah doctor is trying to clear up some misconceptions about Ebola and the serum that's being used on those two Americans.
This McKay-D immunologist recently taught at Emory University Medical School, where the Ebola patients are now being treated.
Yeah, Heidi Hatch sat down with him. She joins us live with more. Heidi, what did he say?
Well, Mark, he said that hospitals here in the United States really do need to be concerned about this. They need to be aware, and they need to be talking to their employees about what they should be looking for.
If we're not really alert, it could be a serious problem, certainly for us.
Dr. Timothy Sullivan believes the U.S. has 2 weak spots.
While we're told, don't worry about it, even if the guy next to you on the airplane is about to die of Ebola, just don't touch him. It is maybe not right.
The disease spread through bodily fluids has proven unpredictable in at least one study.
Ebola-infected pigs kept alongside, but not in any physical contact with monkeys, were able to infect the monkey.
Also at issue, the U.S.-Mexico border, where in recent months, immigrants from Liberia and Sierra Leone have walked into the country.
It's certainly possible that we're going to have cases brought into the United States.
The good news? There's a serum that appears to be working on 2 infected Americans.
They had anti-sera administered that unambiguously, within an hour, had a major effect on Dr. Brantley.
The doctor went from his deathbed to walking into an Atlanta hospital.
The likelihood that was a spontaneous recovery, in my estimation, is 0.
The problem? There were only 3 doses of the serum made in a tiny medical lab with a handful of employees.
After this single dose, a week later, is the virus going to creep back?
The serum, previously only tested on a handful of monkeys, means no one knows what will happen next.
This is a very, very sophisticated tool that these folks have developed.
To create the serum, mice were infected with Ebola. Their antibodies were extracted and attached to human cells, which were then used to infect tobacco plants.
And the plants sit there in the sunshine and the rain.
An extract from the infected tobacco plants creates the serum, which is now gone until a new crop can be grown.
2 months means an awful lot of dead people.
And yet, there is hope thanks to a team of scientists unafraid of government regulation.
It took courage, because if you make the FDA mad at you, it may take you 120 years to get your drug approved.
There are companies around the globe right now trying to work on a vaccine, but this doctor believes that may not be the best bet because third world countries and trying to get everyone vaccinated just isn't realistic. Instead, he says, when these pockets of the virus pop up, if they can give them this serum, that may be the best way to stop it in its tracks. Mark and Shauna.
All right, Heidi.
Recently, Dr. Michael Osterholm, who's the director of the University of Minnesota Center for Infectious Disease Research and Policy, said, "There is scientific and epidemiologic evidence that Ebola virus has the potential to be transmitted via secretion by infectious aerosol particles both near and at a distance from infected patients, which means that healthcare workers should be wearing respirators, not face masks. The recent infection of 2 nurses in Dallas who were using CDC-recommended precautions definitely raises the possibility that respiratory spread is very important, and it is absolutely essential that healthcare workers have respiratory protection with real respirators, not surgical masks, in addition to other precautions."